Infectious disease specialist Dr. Zain Chagla joins us now for his weekly COVID update. Thanks for joining us again.
Morning.
Okay, so we're looking at the possibility maybe next week of the province increasing or lifting capacity for restaurants, gyms, places of worship. Do you feel, as an infectious disease specialist, that it's time for this?
Yeah, I mean, there's never going to be a perfect time. I think we are drifting into a point where, we're going to have to live with how to make things safe, but how to make things, sustainable going into the future. And so, I think it's not unreasonable to consider it. I think there does need to be guidelines in terms of saying, okay, things are getting out of control here and it's time to scale back. But at the same time, Ontario has some of the lowest case numbers and active case numbers that they've had with largely things open. So, I think there is some justification to trudging ahead a little bit. And again, having some guidelines in terms of when to back off.
Right. So good for the economy and good for people's mental health, too, just to get out and for people to be working again.
Absolutely. And again, people did the right thing. They got vaccinated. We do have to recognize that this world needs to get better for those individuals. And, they are at a different level of risk than they were prior to getting vaccinated. And we do have to recognize that.
So that's vaccination against COVID, vaccination against the flu. It's flu season again. Last year's very, very mild. What were there? 6 confirmed cases across the entire country, I believe I heard.
Yeah, very small numbers. Not enough to even count a flu season, basically.
Right. So does this mean then that this year things could be very bad for the flu?
Yeah, I don't know if it's going to be very bad. There were 4 things I think that contributed to last year being better, in the sense that we were masking, physically distancing, a lot of settings were closed, including schools, and travel was restricted. Well, all of those things go back on the table, but we're still masking and distancing a little bit. We still have capacity limits in some settings. And so looking from the examples from the South, there was flu. It was less than prior years, but I think we're going to see more than during the pandemic. We probably won't see as much as pre-pandemic. But, I think it is something to watch for as these respiratory viruses come back, like influenza. They're going to cause a little bit of mayhem in terms of people needing to get tested and hospitalizations as part of that.
Right. And I wonder just anecdotally, because I've heard I know there is a cold that's going around right now. And I've heard from a number of people who have it that, wow, this just knocked me out. It's the worst cold I've had in years. And is that because we just haven't been sick for a while?
Yeah, I mean, I think, part of it might be that bias that we just, we haven't had a cold for 2 years. We forgot how it felt to be knocked out, and we were knocked out. There certainly is a couple of viruses like rhinovirus and parainfluenza circulating. They can be bad in some people. And again, we haven't had kind of that typical boost that we see in a typical year. So there's a lot of factors at play. And absolutely, people have definitely been sick and not COVID negative, but definitely have one of these viruses.
Right. I remember very early on in the pandemic, we were talking to you and you had said that with all of the research that was going into a COVID vaccine, because we didn't have one then, that you were thinking that there could possibly be a vaccine for the common cold. Do you still believe that?
Yeah, absolutely. Look, there are, there aren't great studies, but the coronavirus that we're looking at, and there's a lot of work being done for a pan-coronavirus vaccine. Nothing off the ground yet, but lab models. But the hope is, A, we know that the next coronavirus may happen. And again, we want to be prepared for it. But B, getting rid of the common cold is probably not a bad thing altogether. And if we're using a vaccine anyways to keep our population safe, why not give us future protection against pandemics as well as current protections against the common cold? So nothing off the ground yet, but there certainly are lab models looking at this to try to get off the ground as a, big solution to this pandemic problem with coronaviruses.
Okay, time will tell. In the meantime, we'll cough or sneeze into our sleeve and wash our hands. Dr. Zain Chagla, thank you again for your expertise.
No worries. All the best.